From the common cold to various aches and pains brought on by winter weather, it is time to update your medicine cabinet. Here to share the 8 essentials everyone should have stocked up. We have Dr. Mohammed Shams, hospitalist at Midstate Medical Center. It's great to have you with us, Dr. Shams.
Thanks for having me.
All right, before we get to all that, though, let's update everybody with the flu activity. It is still widespread in Connecticut.
Yep, it's ramping up. We're seeing more cases come into the hospital with the flu. They come in with other things, but they're flu positive. So we're really seeing a lot of that.
So this is why it's really important to check what's in your medicine cabinet so that you are ready. But of course, you've got to get that flu shot first.
Absolutely, absolutely. It not only decreases the severity of illness, it can prevent from having the flu to begin with.
Okay, so let's take a look at the list that you are sharing with us. One of the things you say for a common cold, you have to have acetaminophen.
Definitely. I mean, the brand name is Tylenol, but acetaminophen is really essential in the medicine cabinet. It really reduces the symptoms of a cold, headache, ear pain, that sort of stuff. So definitely you need to have acetaminophen in the medicine.
And the brand name that everybody knows is Tylenol.
Correct. Because
that's what everybody always thinks of.
Yeah.
Do you have Tylenol?
Generic is fine. You don't necessarily need to have a brand name to get the same effect.
Okay. And also, you got to follow the instructions.
Absolutely. We see a lot of patients
that cause issues.
Absolutely. It's not without side effects, especially if you take it more than the bottle recommends, you can run into trouble.
Exactly, and we're talking about stomach issues.
Well, so that is mostly for ibuprofen and NSAIDs, but the acetaminophen is broken down by the liver.
Oh, it's the liver.
So too much of acetaminophen can cause liver trouble. All
right, good. All right, for the cough, you have to have?
Dextromethorphan.
Okay, that's a long name. What is it in general? Brand name?
So that's a generic. So that is the chemical compound. That's the active ingredient in Robitussin.
So that's what we need to look for, is the active ingredient.
Correct. So if you get a generic pharmacy brand that has dextromethorphan in it, it's as good as Robitussin.
Okay, so what does that do for you? So
it decreases the severity of the cough and the frequency of the cough.
And it works?
It works.
Okay, so make sure you have that in the cabinet. Sore throat, I always have these menthol lozenges.
Yeah, so menthol has a anesthetic property, so you can get over-the-counter menthol lozenges from the pharmacy, and it'll really help relieve some of the symptoms of a sore throat.
Oh yeah, as soon as I put one in, it immediately works for me. Of course, here's what we were talking about. For the headache, acetaminophen or ibuprofen. This is what the issues for stomach if you don't take it correctly.
Correct. So acetaminophen, definitely useful for a headache, a tension type of headache, which we all get, is basically, both sides of your head hurt. It's a mild to moderate intensity pain, and it's not throbbing. So, just a mild headache, acetaminophen works very well. You can take ibuprofen with the caveat that if you have stomach issues, you got to be careful because it can worsen an ulcer or cause an ulcer.
Okay, the next on the list is for stuffy nose saline spray.
So saline has historically been used as an antibiotic. And a stuffy nose, if you use nasal saline spray, it'll really help break up some of that congestion.
And next is for a bruise, got to have a
cold gel pack, yes. So a bruise and for a muscle strain, which is you're pulling the muscle beyond its ability, you get a lot of inflammation. So a cold gel pack stocked in the medicine cabinet, throw it in the freezer. You can apply it 1 to 2 hours, every 1 to 2 hours for 15 minutes at a time, really helps.
And just really quickly, acid reflux.
Acid reflux, calcium carbonate, active ingredient in Tums and Maalox. Works very well.
Have all that in the cabinet, you'll be fine.
Absolutely.
Dr. Shams, thanks so much.
My pleasure.